Thank you, Presiding Officer. Can the First Minister tell us how many Scots died last year while languishing on an NHS waiting list?
First Minister.
I don't have that figure to hand, Presiding Officer, but of course, let me say right from the offset, as First Minister, I don't want a single person having to wait longer than they have to. I apologise, of course, to anybody that is waiting unnecessarily on a waiting list for treatment. And I think most people will recognise, I hope most people will acknowledge the significant impact, of course, that the pandemic has had, the biggest challenge I think our NHS has ever faced in its almost 75-year existence. So we are making some progress in relation to the targets that have been set to reduce waiting times, both in terms of outpatients and inpatients. But I think the Government, and I certainly would be the first to recognise, that of course we have to do more. And that's why the recovery of our NHS is a significant priority, is the priority for this Government, and that's why we're investing a record £19 billion this year in order to help recover the NHS and reduce those waiting lists.
Anna Sarwar.
Presiding Officer, the number the First Minister was looking for is 18,390. That's over 18,000 families with a loved one who died waiting for treatment that could have prolonged or in some cases saved their lives. In 2017, 7,868 Scots died while on an NHS waiting list, and immediately before COVID, it was 13,211. And if this current trend continues, it will be over 20,000 this year. These aren't just numbers. These are people waiting in pain, many dying far too early, leaving behind heartbroken families. And as Health Secretary, Humza Yousaf failed to get a grip of NHS waiting lists, and on his watch, they grew by over 175,000. Nearly 2 years ago, he published a recovery plan for the NHS, and since then, things have got worse. So can the First Minister tell us clearly, when will his government meet the legal treatment time guarantee so that fewer Scots are losing their lives?
First Minister.
Can I say to Anna Sarwar, he is, of course, absolutely right to raise the issue of waiting lists and the fact that they have increased throughout the course of the pandemic. I cannot escape and will not escape from that matter of fact. But the pandemic is not just a fleeting matter. It's not a matter that can just be mentioned and then not fully explored in terms of the clear impact it has had. There's no doubt that the pandemic has been the biggest shock that NHS, I think health services in Europe and globally have faced. And that's not unique to Scotland. Of course, I am responsible and we are responsible for the health service here in Scotland, but it's clearly impacted in health services right across the UK. We are making progress in relation to that recovery plan that Anna Sarwar mentions. For example, if I look at the outpatient 2-year waits, we've seen that numbers are down 19% from the last quarter, crucially down almost 70% from quarter 2 in 2022. In terms of 12 months, those that are waiting a year or 12 months in relation to outpatients, we know that since the target was introduced in quarter 3 2022, the numbers of new outpatients has reduced by over 15%. If I look at inpatients, again, we've seen similar decrease. If I look at inpatient day cases, those that have waited over 2 years, we've seen those numbers significantly reduced by 27% since those targets were announced. And we can see a similar pattern in terms of improvement in relation to diagnostics as well. So we are making progress in relation to those targets, and we're also investing record numbers in our NHS recovery and indeed in our social care recovery. But I've always been upfront, whether it was when I was Health Secretary or my current role as First Minister, that the recovery of the NHS will not take weeks or months. It will take years, and that's why we have a 5-year recovery plan that I am absolutely committed in continuing to see progress in, and committed to ensuring it has record investment alongside it.
Anna Sarwar.
Presiding Officer, as Health Secretary, Humza Yousaf said he would have eradicated 2-year waits by now, and he has patently failed. And things were getting worse before COVID, and things have got a lot worse in the 2 years since he published his NHS catch-up plan. And grieving families will see through these excuses. But this isn't even the full picture. According to FOI responses, thousands of people are forced to leave the NHS and pay for their treatment in the middle of a cost-of-living crisis. In one health board alone, the number has quadrupled between 2019 and 2023, and people without insurance paying for private treatment has increased by 73% since before the pandemic. 73%. Our NHS was built on the principle of healthcare free at the point of need, and that is clearly no longer the case for thousands of people in Scotland. So does the First Minister accept that his incompetence has created a two-tier NHS, where people are forced to either go into debt in order to stop the pain and get the treatment they need, or to languish on an NHS waiting list?
First Minister.
No, I don't agree with Anna Sarwar's characterisation. I'll come to why in just a second. It wasn't a list of excuses I read. I read out a list of facts. I read out some of the data, some of the statistics around some of the progress that has been made. Now, that is not to take away from individuals right across this country who are waiting far too long. We know that, of course, waiting on a waiting list can have significant and severe consequences. That's why, for example, we are investing in our national treatment centres. We have 4 that are opening this year. A couple of them have already opened. I'll be pleased in a couple of weeks' time to officially open NTC Highland. We have NTC Forth Valley in the second phase of NHS Golden Jubilee opening later this year, and that will give us additional capacity. We know that NTC Fife plans include 500 orthopaedic procedures this year, rising to more than 700 by 2025-2026. In the first year of opening, the first of the national treatment centres, the National Eye Centre in NHS Golden Jubilee, that delivered almost 9,000 cataract procedures. So we are investing in that additional capacity. In terms of the use of private healthcare, I don't want anybody to have to feel that the only choice they have to go to is private healthcare. But to go to Anna Sarwar's point, this is not because the SNP is in government. It's unique to Scotland. It is, of course, a situation that is affecting health services right across the entire UK. If I take private healthcare as an example, the rate of people self-funding for private inpatient day case care is 19.9% higher in England than it is here. In Wales, it's over 120% higher than it is here in Scotland. So we know that these issues are affecting people right across the UK, and the reason why, of course, is the pandemic. But we'll continue to not just invest in the NHS, we'll continue to make sure our staff are the best paid in the UK. We'll make sure that we don't lose days on strike. Of course, Scotland, the only part of the UK to ensure not a single day in the NHS was lost to strike over the course of the winter. And we'll continue to make sure we do everything we can to fill those vacancies. But there can be no NHS recovery without a social care recovery. And what hasn't helped social care, of course, is Brexit, where, of course, we've seen many staff leave social care because of that hard Brexit that has been imposed on Scotland. So I'll continue to make sure that we have record amounts invested in the recovery of both our NHS and of social care too.
Question number 3, Ariane Burgess.
To ask the First